Hi, welcome to my space. My name is Akonwa. If there's anything I have learned throughout my practice of midwifery the past 10 years is once the baby is out, all the attention is moved away from the mother to the baby. And there is you with a series or a marathon of process that your body needs to go through in order to heal. This video is going to go through some of the things that you are going to go through once the baby is out. We are going to discuss various things that are not spoken about so much. Especially if you're a first-time mom, these are some of the things you are supposed to prepare for so that you don't get overwhelmed or they don't catch you by surprise. Let's talk about the big one, bleeding. In clinical terms, it's called Lochia. Your uterus shedding its uterine lining, the things that was together with the baby when you were pregnant. In order for the baby to grow, the body is going to shed all of them. It is similar to what we go through during our monthly sessions, which is our menstrual cycle. But this time around, the uterus grew bigger, so what you'll be shedding will take much longer and it will be heavier than the normal one. So the first 5 days is going to be similar to what we go through during our menses. This blood is going to be dark red, heavy, sometimes with clots. The flow pace is mostly also similar to our menstrual cycle, the ones that we shed every month. But this time around, it can be a little bit heavier, like I've explained earlier. But as a midwife, this is what I want you to watch out for. If you are soaking through your maternity pad in less than an hour, if you are passing clots that are bigger than a golf ball, then you have to approach your midwife or you have to call for your caregiver to assess you. You might be going through something called postpartum hemorrhage. I am going to leave a clinical picture here for us to know the different sessions and the different color so that most of us who are very visual will understand. The second session, after the first 5 days, the fluid that you are going to shed is going to be pinkish or pinkish brown, this time around with less blood. If during this time you are seeing a little bit blood, it might be you are doing too much because the wound is there. That is where the placenta was attached to your womb. It's still wide open. That wound is still there healing. So if you overstress or you do too much, there might be a little drop of blood. So when you see blood which is similar to what you saw in the first 5 days, then it's a sign that you are supposed to get back to rest. Or even if with rest you are still seeing blood, there's something still called secondary postpartum hemorrhage. You should report to the clinic. This discharge can take anywhere between 2 to 3 weeks to shed the pinkish brown fluid, which we usually call the serosa in clinical terms. After this session is over, depending on how long your discharge is going to be. Personally, my first baby, it was about 33 days before I didn't see any drop or didn't wear any pad again. And it's different from different women. So we generally conclude the bleeding will be from around 3 to 6 weeks, depending on the woman. After the pinkish brown discharge, the next one is usually white, similar to vaginal discharges, without itching or without any foul smell. And this can take 1 to 2 weeks before it's finally gone. Let's talk about hormonal changes and some of the symptoms that these changes might cause. The most common symptoms of hormonal changes is shivers and sweating. Different people go through this one at different time during the first week or first 2 weeks of postpartum. The very common one right after delivery is shivering. This is because the two hormones which were involved fully during pregnancy, which is estrogen and progesterone, are trying to find their way back, trying to fix their levels, and these changes are usually sudden. And so this is a way of your body reacting to these hormones. So right after delivery, a lot of people usually shiver a lot. Ask your hospital or your caregiver to get you huge blankets to assist you during this process till we watch it pass. We usually don't do much. We get you the warm blanket and reassure you for this scene to pass. And depending on the hospital protocols and other things they have to get you back. So if you're at home and you are having these shivers, get your warm water, get your warm blanket, sip it slowly, and lay in bed and watch it pass, because these are hormonal and they might go away. But watch out, if these shivers are very persistent and they are not going away, it is coupled with full body pain, fever, foul smell from the vaginal discharge, or if you had a C-section, the wound might be gaping or something, then you have to report back to the hospital. So with every normal process, I am giving other things that you are supposed to watch out for, so that you can genuinely report to the hospital without being scared. Come to us at the hospital at any time and we will be ready to assist. On the other side of the shivering is sweating. So for some people, they are going to sweat a lot, especially in the night. So you might wake up in the middle of the night trying to feed your baby, and you'll find out you are drenched in full sweat. All your clothes or your bed sheets could be wet. The sweat could be a little bit excessive. This is a way of your body getting rid of all the fluid buildup is stored to provide for the baby, or for your body to regulate to accommodate the new human being who was in your body. So your body is now shedding it. So what you can do during this time is to get lightweight clothes, cotton based clothes, easy to wear with spaces in between so that you can get more airflow. And then you get extra ones in the night, so that when you wake up and you are fully drenched in sweat, you can quickly change whilst you change your baby as well. And make sure you fix yourself a big jar of water so that you could be sipping along whilst you are losing this water, to replace what you are losing rapidly, so that you are not dehydrated. If you might be breastfeeding, if you are dehydrated, you might have other issues like headache. So make sure you stay hydrated whilst you lose all these fluids. The shivers and the sweats are not comfortable, but what you would do is to prepare your environment to fit some of these things, so that when you are facing any of these issues, they do not get overwhelming. So as you plan for your baby, as you shop for the baby, shop for things that can help your postpartum be less overwhelming and be more comfortable. You are also important as well. Now let's talk about one of the very scary things during postpartum, the ones I personally help most of the moms through, because it's very scary, especially when it comes to the new moms. That is your first bathroom trip after delivery. If you had a C-section, you are usually okay with your first urination. So you might not have any stitches or any vaginal swelling. Some went through labor before it ended up in CS. So some might still have some vaginal swelling or hemorrhoids. So they might still go through some of these scary parts. It depends. And depending on your delivery, you might have tears, scratch, hemorrhoids, swellings in the vagina, different things that might happen during delivery. So it makes the first bathroom trip scary to a lot of mothers. One big midwife rule, we will always say, do not hold it in because you are scared. Once you feel you want to visit the bathroom, but be in it to pee or to poo. So let me help you to the poo. When you get to the bathroom, sit on your toilet seat. Get yourself a small stool what which can help you prop your legs up. That way gravity can help you more. Then you hold your abdomen in order to support you throughout the pain, because you still might be contracting, and open as wide as you can. Then you breathe in, and whilst letting it out, make sure the force is at the back so that you can blow out whatever is there. Do not push so much because you might end up breaking your stitches. If it is really difficult, then come out, ask your midwife or your caregiver to prescribe you stool softness so that it can help you. Make sure you are drinking a lot of fluid, and every food you are eating after delivery is in aid for you to pass your first stool easily. So very light foods, less dry foods like bread, crackers, and all those things. More soup, more fruits, more water. For urination, do not go to the bathroom with our normal traditional tissue. Get yourself a peri bottle. Whilst you are peeing, you are pouring water from the bottle as well. And the bottle is shaped in such a way that it can get the water inside a little. So you keep pouring the water. Make it warm to feel soothing. Well, you keep pouring the water whilst you pee, so that the urine do not stanch the stitches or do not stitch the various cracks that you might get. There are some cracks that do not even need stitch. You can have about 3 to 4 or different versions throughout the vagina, from your clit down to inside the vagina where the baby came from. There could be different scratches everywhere. So whilst you pee, you pour the water so that the pee do not stitch any of these wounds. That is not so difficult for you. And after you are done and after you have washed, do not use our traditional tissue. Get yourself a washcloth, dab it in warm water. After you are done, pat it slowly to absorb the water to keep the area dry, and change your pad. Usually, if you can afford it, you have more pad available. For the first 2-3 days, when you visit the washroom, you can change just for comfort sake. It's on the extreme side, but I personally did it and I found it very comfortable. Once you visit the washroom, you change so that anytime you come to bed, you are feeling fresh and your mood is uplifted. Some of these things really help during the overwhelming state of postpartum. Thank you for staying. Bye.